Okay, you're on.
Excellent, thank you. Well, again, good morning, everyone. Thanks for joining us on a very blustery morning. I can hear the wind just whistling around my house, so hopefully that won't come through too much on the audio. I do hope that we have a few more people joining us, but let's go ahead and get started in our November 2020 meeting. I can't quite believe that it's November 18th. I don't know if you guys are feeling the same way, but wow, the time is just flying by. Here is our agenda today. As usual, we start off with a welcome and introductions and just a little housekeeping. Then we'll have a few minutes of announcements. Then we'll move to our brainstorming time, which is, of course, your time. So we hope that you'll take full advantage of that and talk about anything that's giving you some troubles, anything you'd like to get some advice or help from the group. We love to hear, new resources, updates on cases, anything you're doing with motivational interviewing, with quality improvement, all of those things. So I'd love to hear that. And then right around 9, we're going to move into the main topic, which is really talking about how to support siblings of children and youth with special healthcare needs. And Heidi is going to kind of lead up that part of the meeting. And so we really appreciate Heidi taking over at that point. We'll hopefully have some time for discussion toward the end, and we'll wrap up promptly at 10. So with that, let's go ahead and do our introductions. And so I'll start. I'm Mindy Tueller, and I manage the Medical Home Portal, and I facilitate this meeting and have been doing that for quite a while now. So hopefully most of you know me. And then let's just, I'll just try and go through the list that I can see. And it looks like next on my list is Gabby.
Good morning. My name is Gary Baragoshi. I am one of the quality improvement specialists at UPIC and also the AV person for today's meeting. So feel free to, if you don't have audio connected to your computer, write it in the chat box and I will read it out loud.
Thanks, Gabby. All right, Chuck.
I'm Chuck Norland. I'm the director of the Medical Home Portal and a general pediatrician at the university. And Gabby's mention of audiovisual person reminded me of my days in junior high school when I used to load the reels on the projectors for movies. It's a fond thought, but a long time ago.
Mindy, we cannot hear you.
Little more.
Okay.
All right, next on my list is Araya Purcells. Can you hear me now?
Yeah, we can hear you.
Gosh, Gabby, maybe you better do it. Oh, good, okay.
I just introduced myself.
Yes.
Hi, I'm Araya. I'm a sibling with a child with special needs, and I'm here for the Sibling Council and answer your questions.
Perfect.
That's fantastic. All right, next, actually, I'm seeing someone whose name isn't showing up, so maybe I'll skip over that one and we'll try and figure that out toward the end. And next I see Natalie Allen.
Hi, I'm Natalie Allen. I'm a nurse practitioner and I work for Children with Special Health Care Needs, Eric's ISP team, as well as faculty for the University of Utah.
Great, always nice to have you, Natalie. The next person I see logged in is, it just says CSHCN, so I'm not sure if that might be someone from Eric's team.
I think it's me. This is Gwen, and I am part of Eric's team. I cover Carbon, Emory, and Grand County with children with healthcare needs and integrated services. Good morning.
Good morning. Hey, I did not catch your name quite. You cut out a little bit. Can you repeat your name, please?
Gwen, G-W-E-N Anderson with the S-O-N.
Thank you.
Welcome, Gwen. It's always nice to have you. The next name that I see showing up is Cherry Tree. So whomever is logging on from Cherry Tree. Okay. Let's see, how about Athena?
Hi, this is Athena Parker, and I work with the Medical Home Portal and maintaining the Utah Services Directory and then working with some of our state partners.
Great to have you, Athena. Next, I see Walt.
Good morning. This is Walt with the Integrated Services Program, which is part of the State Department of Health, and I'm a care coordinator with the team.
Great. Welcome, Walt. And I see Jill Connor.
Good morning, Mindy and gang. My name is Jill Connor. I am the Director of Business Development at Shriners Hospitals for Children.
Good morning, Jill. Glad you could join us. And I see Gina Money.
Hi, Gina Money, and work with the portal and UCCCN.
Glad you could make it, Gina. And I see Dora.
Good morning. I'm Dora. I work at Shriners Hospital as their professional relations coordinator. I'm happy to see your faces.
Thanks, Dora. All right, Linda Stevenson.
Hi, I'm Linda with Eric's team with Integrated Services, and I am in Central Utah in Fillmore today.
All right, terrific. Let's see, I have someone calling on the phone. I show you as caller 3. If someone's on the phone, do you want to go ahead and introduce yourself?
We have Cherry Tree wrote in the chat box. My name is Evelyn. I'm the care coordinator for Utah Valley Pediatrics at the Cherry Tree office.
Terrific. Welcome, Evelyn. All right. And how about Alma?
Hi, my name is Alma, and I'm one of the nurse care managers out of the Redwood Health Center, one of the University of Utah outpatient clinics. And I work with adults and peds, so.
Great. Nice to have you, Alma.
Thank you.
All right. I see Sherilyn Hess.
Hi, my name's Sherilyn. I am the nurse care manager at Intermountain Pediatrics in American Fork.
Very good. Glad you could be with us. All right. I see Heidi.
Hi, I'm Heidi Bates. I am one of the UPIC coaches.
Great. All right. I see Katrina Jensen.
Hi, good morning, Katrina Jensen. I'm from Intermountain Healthcare Pediatrics, project manager. Work on transition. Thank you.
Glad you're here, Katrina. And Janelle Hendrickson. Janelle might not be able to.
Janelle is a care manager at Intermountain, the holiday clinic, I believe. Please correct me if I'm wrong, Janelle.
And I see Kelsey.
Hi, Kelsey Hamadou here, care coordinator at San Juan Public Health for Eric Christensen's team Integrated Services Program.
Welcome, Kelsey. Glad you're with us. And I see Cassie Crane. Gosh, Cassie, I see that you're unmuted, but we're not.
Yeah, Cassie Crane, she wrote in the chat box, I don't think I have a microphone access, but this is Cassie Crane, and I'm a care coordinator at Wasatch Pediatrics South Point.
Very good. Terrific. Well, it looks like we probably have skipped over maybe 2 people whose names I don't see.
So caller number 3, who is on the phone, could you please speak up?
So I'm Nikki. I'm a registered nurse care coordinator with Busy Bee Pediatrics in Bountiful.
Hi, Nikki.
Hi, Nikki. Glad you're with us. All right. Very good. Well, let's go ahead and jump into our meeting. Again, welcome everyone. We're really glad you could join us today. So just a couple of housekeeping things. We say the same thing every time, that we think your experience with these remote meetings, these all virtual meetings, is best on the computer if you're able to do that. And we'll try and respect your time and end promptly at 10, if not a little bit sooner. All right, well, an announcement, some information that was released recently is that there is new guidance on care coordination for children and youth with special health care needs. And perhaps some or many of you have been aware of this. This is just recently released from NASHP, and the Lucille Packard Foundation for Children's Health was a part of that. So let me show you, I've got that pulled up here. NASHP is the National Academy for State Health Policy, and this is quite a big effort. I've been reading a little bit about what went into it, and it was very rigorous. And they have again released these standards at the national level for care coordination that are fairly robust, and we wanted to make sure that you are aware of those. And just see if you might have an interest in diving into them a little bit more through UCCCN. As you can see, there are 6 domains. I hope you can see that. It might be a little bit hard. Let me switch back to the slides. There are 6 domains that they're really focusing on in this guidance, in these standards. 6 domains that I think you guys are very aware of in your own work, at least to some degree. Screening, identification, and assessment. A shared plan of care, which, gosh, we know how tough that can be, and yet also how important if you're able to do it. Team-based communication, child and family empowerment and skills development, care coordination workforce, that's kind of you guys, and care transitions. And of course, we've spent quite a bit of time on that, and that's a huge component, right? So they've got this infographic that I grabbed. Again, I'm not sure that you'll be able to see it super well, but it kind of, it's a little bit of a, a flow chart, shows the continuum here of those 6 domains, those elements. And it's a lot. So I'm kind of dumping this all on you pretty quickly, but the link to the report will certainly go out in the summary, the meeting summary, and yeah, we'd just like to know your thoughts if this might be something that, this is a little different than what we've tried to do in these meetings. We haven't really done any sort of structured training that's meeting any sort of outside standards or guidelines, and the report doesn't actually give us super great steps to do that. We'd probably have to do some brainstorming and figure out how to translate the report to training itself. But we wondered if this might be something that you and your organizations might be interested in having happen through UCCCN. If anyone wants to speak up now, you're certainly welcome to. Otherwise, we'd love you to take a look at the information once you get the link, and let it sit with you for a little while, and then let us know if it's something that you might be interested in. All right, everyone's quiet. That's just great. All right, we wanted to let you know that we have been working away on content in the medical home portal. There's so much that I'm actually not going to be clicking on any of these links because it would take a while. I've got another slide next. But we've done a fair amount of clinical content updating, and we've actually got a new kind of mini module on acute flaccid myelitis. And we've done some updating of our celiac disease module and our traumatic brain injury module as well. And then we just did an optimal clinical coding page update, and it's got some new information there that we think might be very useful. So check that out. Again, these links will all come to you through the Resources of the Month email that we send out, but you can also just jump on the portal and search those topics too. So in our families section, we've updated all of these pages as well. So we've got some FAQ pages in there that correspond with our clinical content that's really written more a little bit for professionals on the medical home team. But these are the pages that sort of correspond, written specifically with families in mind. So ADHD and premature infant, frequently asked questions and answers. And then we've got information updates on the ABCs of behavior, end of life issues, responding to a diagnosis, services for the uninsured or underinsured, and service support and therapy animals. This was previously called, I can't quite remember, a slightly different name, but we've changed that name a little bit and updated that page. All right, so it's our brainstorming time. This is your time, so we hope that some of you might have things that you're willing to bring to the group or share with the group. So I'll just be quiet and let whomever is ready speak on up.
Before we move on, so Kelsey, she wrote that I would definitely be interested in diving into this further on the UCCCN platform.
Okay. Thank you, Kelsey, for that feedback. That's the National Standards on Care Coordination. Okay.
Mm-hmm.
All right, so anyone who wants to speak.
This is Jill Connor from Shriners. I just want to remind everybody about our new implementation of our fracture care hotline. It's been going really well for us, and as a reminder, that number is 801-888-4068. And again, that's for non-emergent fractures.
Thanks for that reminder, Jill. I'm glad to hear it's going well. That's great. Anybody else? How's it going now that the weather is getting cold? And, you know, are you seeing other changes happening in your practices?
Mm-hmm.
Mindy, this is Tony with the Integrated Services Program. I just wanted to just remind everybody to think about Christmas for your families and maybe call 211 to see what resources are available in your area, and you know, just so you could be aware of that and start calling families, because a lot of those places are, I hear that they're going to be really full this year. And a lot of programs that helped in past years are not helping as much this year. So you really want to, if you want the help for Christmas, you really need to get on it.
Mm-hmm. Thank you, Tony. That's a good reminder. We need to start thinking way.
I want to take the moment to just talk about for a few seconds about our upcoming project, the Mental Health Access Integration Project for 2021, which will start in January. And what we are trying to accomplish, and that's really trying to accomplish, is a bidirectional communication between primary care, pediatrics, or providers, and mental health or behavioral health providers in a community. We have recognized this, it's like a big black box, you know, you refer children out and then you don't hear anything back. So with the help of Intermountain UPIC, we are trying to come up with a process to overcome that gap. So if anybody is interested to learn more about it, please feel free to email me. That's all I had to say. Thank you.
Oh, Gabby, that's exciting.
Mm-hmm. I'm very excited. Yeah, we had a call with Connecticut Children's on Monday. They are doing a similar project right now, and they have come up with some good processes. So I'm very excited.
Wonderful. All right. Well, we'll make sure to, you know, send out a specific message about that, but it'll also be written up in in the resources, so you'll have Gabby's information if you need it. Great.
Hi, this is Walt. Along the lines with what Tony was talking about, the Bicycle Collective is a really good agency. They are open at this point in time. They have used bikes as well as new bikes. They refurbish bicycles that look brand new. And I had a family that we went in and they fitted her very well. A very nice bicycle. And I kind of think, you know, the weather's been relatively okay with that, and maybe that'd be like a Christmas gift for families. And they realize that if a family is struggling with income, they help with that. They're a really good agency.
Thanks for reminding us about the Bicycle Collective, Walt. I remember that previous story and case you brought, and that's so nice. They are a really great organization. Good reminder. Thank you. Anybody else?
This is Gwen. I'm not sure. I think this is statewide, but I was told that any of our families that need to apply for the COVID rent relief, that they need to do that before December. So that is ending. And depending on your county or your agency, they may still have funds or they may be running out of funds. So any family that has, and I've kind of heard this informally, but that if any family has been affected for COVID, they are telling me, at least in my area, that they will most likely be approved. They just have to go through the application and verification process, but most families are being approved for help is what they told me yesterday.
Great. Thank you, Gwen. Is there any chance that you could shoot me a link for that?
I'll try to find something. It's usually our local association of governments is doing
That's
it,
fine.
But with DWS or any of those agencies, but I'll look.
January 9 o'clock.
Okay, so I think that's plenty of information. Thank you. Very good. Anyone else?
Mindy, that website for what Gwen was talking about, it's rentrelief.utah.gov.
Perfect. Thank you.
Mm-hmm.
Yeah, it's a tough time right now for sure. All right, well, if we are ready to move on, I think that's okay. Heidi, are you ready to move on?
Yeah, of course.
Okay, great. Well, what I'm going to do is switch to Heidi's slides now. And let's see, I hope we have, I might be a little premature. Let's make sure we have our panelists on.
Yeah.
Let's see, is Sydney with us? Might be just a little bit premature. Oh, as I'm looking through them, I do see a couple of other names who have joined us, so that's great. Maybe we'll take a moment to ask them to just quickly introduce themselves, if you can. Cynthia, do you want to introduce yourself?
Sure. This is Cynthia Palacios Gutierrez. I am with the Integrated Services Program, and I am the clinical psychologist on the team.
Great. I'm so glad you could join us. And how about Mallory?
Me?
Yep.
I'm with Help Me Grow Utah. I'm just joining to learn about how to support these families. So I won't have, I don't know if you're expecting me to share something, but.
Oh, no, not at all. Just wanted to know who you are. So that's great. Thanks, Mallory. We're glad you could join us.
Thank you. It's good to be here.
Just looking through the rest of the list to see if anyone else is on there.
I think you covered everything.
Okay. Great. Well, let's see. Let me pop out while we're waiting for our other panelists to jump on. Let me just pop out to the medical home portal and just remind you that we do have this information about COVID-19 that's on our site. For some reason, there we go. It's a little slow. There we go. So we keep this page quite updated. And there's also information specific for Utah on here again, if you're in the Utah Medical Home Portal region. So I just want to remind you that this is a source that we try and stay on top of, and that might be valuable or helpful to you. It's got information that's specific with schools. And information that's a little more focused on it for families. Mental health. Some connection technology information. And then clinician resources. A long page, there's a lot on there. Right. Okay, let's see.
This is Gina, and Tina just texted me and just said, for those that are in Salt Lake City about the food, that there are resources for families at the Calvary Baptist Church, and they have big boxes of fresh produce, dairy, and protein that can be picked up every Tuesday and Thursday.
Wow. Tuesdays and Thursdays at the Calvary Baptist Church in Salt Lake.
Yeah.
Okay, that's great. Thank you to Tina. Yeah, I've certainly been hearing quite a bit about the food insecurity that's happening alongside the pandemic.
It would be, I wonder if there is, and maybe 211 has this, and I know that Tina probably has more information, but for some of us that, want to, it's kind of getting overwhelming on the opposite end too, on the most reputable places to donate as well, because we want to make sure that, if we have food or if we want to donate, financial resources for food or Christmas, where some of the best places to donate are.
Right. I mean, do we have any direction on that?
Mindy, my sister works for YCC. It's a women's shelter. And so I know she says that they're always needing money to help their families and the women and children that are in their shelter. And so I think if you would find your local women's shelter, I think that would probably be a really good idea. I think that would go directly to, you would know that it would go directly to a family.
in your area, and also just any homeless shelter.
Well, that's a good idea. Great.
Sydney Christians joined us.
I see that. That's great. All right.
This is Tina. I just want to let you know I'm actually working on a couple lists, and I'd be happy to send them to Mindy, and she can get them to you guys for both resources for families who need something, or for places that you can maybe adopt a person. I've got not only children with disabilities, but senior citizens as well. So I can send that out to Mindy.
Would love that, Tina. Thank you.
Yep.
Okay, terrific. All right. Well, I'm going to move us back into our main topic. And Heidi, I'm going to let you take it over. And Sydney, we saw that you joined, so thanks so much. And we're going to switch gears and talk about siblings of children and youth with special healthcare needs.
Yeah. So, hi, I'm Heidi. I'm one of the UPIC coaches. I know my daughter's on too, Alexis Bates. And is Araya on? Yeah. Oh, hi, how are you? Okay, what I'd like to do is I would like you all just to introduce yourself. And I'd like to know where, like, is your sibling that has the healthcare need? Are they older than you, or are they younger than you? And if you're comfortable sharing what healthcare need they have, you can do that. If not, that's fine too. So I will start with Araya. Can you just tell, just about your sibling? Yeah.
Yeah, so my name is Araya. I am 20 years old, and this is Adam. He is also 20 years old. He'll be 21 in February. Adam has cerebral palsy, autism, and other medically fragile needs. And he also has a tracheostomy and a feeding tube.
Thank you. Sydney?
Okay, my name is Sydney. I am 22 years old. My brother Charlie has type 1 diabetes, and he is 24, so he is older than I am.
Very nice, very nice. And it's Lexi. You can go ahead and just.
Yeah, hi, I'm Lexi. I'm 18 years old, and my brother is 15.
All right, so we're just gonna ask some questions here. Let me pull up my questions that we did, and either all of you or one of you can go ahead and answer these questions. My first question is, how did you feel, or how do you feel when a parent has to spend more time with that other sibling?
So I'll go first, if that's okay. Yeah. So I actually never had to struggle with my parents spending more time with Adam, because they were actually very good about giving me my own time as well. There would be weekends where it'd be just me and my mom, or just me and my dad, and we went out and did something. And I knew that they spent more time with him because he needed it. And I was a lot more, I was more independent than Adam was, and I had other things that I could do.
Okay, I'll go next. So my brother was diagnosed when he was 3 years old, so that would make me about 1. So he has had diabetes basically my whole life. And growing up, having my brother with diabetes, there would be times where my parents would have to spend a little more time with him if his blood sugar was high, his blood sugar was low. But my parents were very good teaching me and my other brother about diabetes and what it is that Charlie had. And so we both had an understanding of why they needed to spend a little more time with him. So I never felt neglected, or I never resented Charlie because he had to have more time with my parents. I just had an understanding, and I knew that, you know, it was almost life or death basically for Charlie if my parents both had to have one-on-one time with him.
Hey, Lex, you can answer this question, and it's a safe place. I won't even get mad at you.
Okay. Like the other two, I totally understand that my brother Clay, he needed a little more like time just to like, he just needed more time, and I totally understood that. And my mom was really good about letting me know and communicating with me that, you know, like it is harder for him to communicate with people. And so I totally understood that he needed more time and help with how he dealt with that.
Thanks, Lex. Just so you know, my son has, he is on the spectrum. He has learning disabilities, and he was nonverbal till he was about 2. And even now it's hard for him to kind of just communicate. So reading and writing and all of that. So that's my son, and Lexi is his older sister. So, all right. The next question is, how do you feel, or how are you guys feeling about the responsibilities that may fall to you as that sibling? So, you know, heaven forbid something happened to, you know, their caregivers. How do you feel about those responsibilities?
So are we just going to go in order?
Yeah, that's fine.
Okay. So the responsibility, I think about this a lot actually, and it's kind of scary. It really is. For me, it's kind of scary thinking that one day I will be Adam's sole caregiver. And I know that I don't want him to be anywhere else except for with me, where I know he is safe and I can take care of him. And I'm already planning on how I'm going to do that, how I'm going to set up my life to be able to do that. But I know there's other like siblings out there. I have a friend who says she probably couldn't do it. Her brother also has special needs, and it depends on how, I don't know what I'm trying to say, but it's a scary situation that the sibling really has to think about and come to a decision about. And that decision needs to be respected, because some people want to live their lives and do their own thing without having to take care of their siblings. But that's not me. I know he's going to be with me for the rest of his life.
And are you comfortable with that? And you're ready to take on those responsibilities? And
yeah, my parents have always said, like, it's not your responsibility. You don't have to do it. But I've always told him, like, no, he is my brother. I am going to plan my life to where he can live it with me and be happy and do the things he loves. And I've thought and I've planned. I've thought about how my house is going to be, or how I'm going to work, and how I'm going to go to work, and who's going to take care of him when I'm at work, or if I'm going to bring him to work with me. You know, I've thought about it all since I was probably 15. I started thinking about it. And
wow.
I'm sort of there to where I think I know what's going to happen, but it's a long road.
Yeah, for sure. Sydney?
So with Charlie, the responsibilities aren't as much now that we're both adults. But growing up, him and I would attended elementary, junior high, high school together. And the schools all knew that I was his sibling. They knew that he had type 1 diabetes, and they knew that if anything were to happen, that they would come and get me, even though I was the younger sibling. I had things like fruit snacks and glucose tabs in my backpack just in case his blood sugar were to fall low or anything like that. I have always kind of thought, though, because my mother has siblings who have type 1 diabetes as well. It just kind of runs in the family. And her brother has had kidney transplants. And so there is a possibility that, you know, one day my brother may need a kidney. And I hope that I'm a match for him, because I will absolutely give him one of my kidneys. My brother is my best friend, and I want to be able to do anything I possibly can to keep him around as long as I can.
Oh, wow. Very nice. What about you, Lex?
I thought about this. I mean, not that much, but I would love, like, well, I would, if anything happened to my mom, then I wouldn't hesitate to take care of my brother, because I know I wouldn't want him, like, to go anywhere else where he feels uncomfortable and where he's not, like, doing the best that he can. So I would be happy to take care of him.
Mm-hmm. All right. And the next question, what advice would you give other siblings or parents? If you came across somebody who was struggling because they didn't, you know, about their child and how to address the sibling, what advice would you give them?
So for me, the advice I would give the parents is to make sure that the sibling understands what is going on and what is happening. As long as the parents are on top of making sure that the sibling understands what's happening to their other sibling, that helped me anyways. I understand what his disabilities meant, and I understand. Yeah, it's kind of a stumper. Like, I don't, just understanding, I guess, and patience with your sibling, you know. I had to have a lot of patience with Adam. I was adopted when I was 7, and I had to learn all this stuff about him that so quick, you know, but because of it, he became my best friend. Like Sydney was saying, he's my best friend, you know. And spending time and just learning and maybe researching about the disabilities will help the sibling understand what their sibling is going through.
Yeah, thank you. Sydney?
Some advice that I would give parents is kind of along the same lines. Just make sure that your other kids are educated on the illness or disease that your other child has. I think the best thing you can do is educate your other children. That way they, you know, God forbid something happens to you, can help in any instance. Or like in my case, I was at school with my brother, so my parents didn't need to stress about if something were to happen to my brother at school. Just educating your other kids about the disease that your other kid has. That way they can know, because I knew from a young age about my brother's disease, and I knew how to handle it. Advice for another sibling would just be to have patience and be kind. Your sibling is already going through so much. There are times that I wish I could tell my younger self to be nicer to my brother. I don't know if anyone has ever experienced anyone with type 1 diabetes, but sometimes when their blood sugar is high or their blood sugar is low, they're very mean. And I wish that I would have been a little more patient with my brother than I was back then. So yeah, just be patient and kind to your sibling, because they're already going through so much. The least you can do is just be a good sibling to them, and even just a voice, or like someone for them to talk to even.
Yeah, that's nice. Bex, do you have any advice?
Yeah, likewise to what both of them have said, I just think patience is like a really big key thing here, because like that, everyone learns at their own pace. And I know it's frustrating for, like, if you can't understand them, but it's probably more frustrating for them than it is for you. So just like be conscious of how patient you are with them, I guess.
All right. Thank you. All right. Thinking back to when you were younger, 7 or 8, doesn't matter which age you want to be, 10. What issues did you have to struggle with at that time? If you guys remember struggling with anything at that age, with your sibling or with your parents or anything like that?
So I had a lot of problems when I was 7 or 8 of my own, but the one thing that was really hard for me that I struggled with was that my brother got free iPads and I did not. It made me angry. I wanted an iPad as well, you know, and I voiced my opinions multiple times to my parents, but they sat me down and told me, like, hey, we didn't buy him this iPad. It got donated so he can help, so he can talk to you, you know, and he can use it for himself to talk to you. And just obviously now I understand, and I never blamed him for anything. I always blamed my parents or the people that donated whatever. That's the one thing, was the materialistic aspect of the stuff he got. I wanted the wheelchair. I wanted the trach. I wanted all that stuff. I wanted to be like him when I was little, and it made me mad that I wasn't.
Yes, that is a good point. What about you, Sydney?
I can't think of many instances, like many issues that I ran into when I was younger, but I do remember, I think I was about 8. One Easter, my brother had to spend Easter and the following days in the hospital. They couldn't get his blood sugar under control, and my parents were both with him. He was only 10 at the time. And I remember just being so mad because I wanted to get my Easter basket right then and there, and I wasn't very understanding at the time, you know, and I remember being kind of mad at my brother, but, you know, it wasn't his fault. He had no control over it. We ended up doing Easter like a couple days after he got out of the hospital, but I just remember being so mad that we couldn't do it on Easter. I wanted to, you know, wake up and go have an Easter egg hunt, but we couldn't do that because, you know, Charlie was in the hospital.
Yeah. All right, Lex, it's you now.
I think the hardest thing when I was little was trying to understand my brother. Because, I mean, I would get frustrated with him because I can understand him, but I was more frustrated with myself because I'm like, it's like, I don't know, I just couldn't understand him, and it was really frustrating because it was frustrating to both of us because we couldn't really communicate the way we wanted to. And then a couple years passed, and then I can understand him like really well, but other people couldn't. So like trying to watch him communicate with other people was really hard for me because I knew what he was saying and he knew what he was saying, but the other people didn't know what he was saying. So at times I would want to say, like, I would want to be his voice and want to speak for him, but I knew that he would probably get mad at me if I did that anyway because it's really headstrong. But
yeah,
I think that was the hardest thing.
All right. So the last 2 questions, I'm going to kind of put them together, was how has being a sibling with somebody that has healthcare needs changed your life negatively and positively?
So I don't think my life has been changed in any way, in a negative way. With Adam, I believe he has made me into the person I am today, and the only vibes that come off of him are positive ones. If I was younger, the positive thing about him was probably that I got to skip the lines at Disneyland. You know, but now that I'm older, I realize that he has taught me humility and kindness and understanding of other people with healthcare needs like him. You know, I have more friends in the disability community than I really do in my community, you know, and it's nice to have that family around and to have people that understand what you're going through as well. I think that's the positive part of him and what he's done for me.
Thank you. Thank you. Sydney?
I can't think of anything negative as well. My whole life has been, you know, Charlie's had diabetes, so I can't think of my life going any other way. But some positive aspects, I know about type 1 diabetes, and I could talk to someone about it, and I feel like I could educate someone on it as well. But another positive aspect is just having my brother in my life. He has been through so much in his life, and seeing the incredible adult man that he's turned into, it's awesome. He's overcome so much, and I think that's definitely a positive, is just watching him grow up struggling with this disease, but not letting it define him and not letting it make all of the decisions in his life. He's overcome so much and is now super successful. He's super successful in his life, so I'd say that's a positive.
That's fantastic. Thank you. What about you, Lex?
I don't really have a negative. I mean, there are many positives. I think because of Clay, my brother, I understand people go through I understand more about people and more about disabilities, and it's easier for me to communicate with other people because I learned how to communicate with him, if that makes sense.
Yeah.
Yeah, I don't think there's any negatives. Like Sydney said, it really helped me as a person to watch him grow up and be more verbal, and he's now coming out of his shell, which I think is amazing, because looking back on it, he would never ever, he couldn't get his words across, but now he is actually trying to voice his opinion at school, and I just watching him come out of his shell is really is a positive thing for me.
Great. So those are the ends of our questions. Is there any questions that the group has for these siblings?
This is Chuck Norland. Thank you very much. That's very heartwarming and really very, very good information for us. I wonder if any of you had experiences of going with your sibling to a doctor's visit or to a hospitalization or other forms of interaction with medical care providers, and whether there was anything you learned or were struck by or wish had gone differently during those encounters. Whether that relates to how they dealt with your sibling or how they dealt with you as the sibling in the room.
So I never really went to a lot of Adam's appointments, except for the physical checkups once a year. The one thing that always, and it still does, is Adam is this strong, almost like Dwayne "The Rock" Johnson, and he will tear up everything and anything once he sees that you are a medical professional. And it makes me want to try and figure out a way to help him calm down and not be scared of the medical profession. You know, obviously he spent a whole year of his life in the hospital, so those memories come back to him. So that's one thing is I want like the professionals, like listen to the parents and the siblings when they tell you like, hey, don't do that. He doesn't like that, or you're not going to be able to do that. You know, like trust us and listen to us and don't try to like push past us and do it anyways, because you're not going to do it. You're going to fail. Like a funny story about this is they were trying to take Adam's height with the paper measuring tape at the doctor's office. And we told him multiple times, you're not going to be able to do it. Don't do it. You're not going to be able to do it. He will hurt you. And she tried to do it anyways. And he ripped that thing to shreds. He was pushing, kicking her, you know, and we were like, we told you. And she goes, let me just go get another one. And so she just goes, gets another one and comes back and tries to do it again. And, yeah, the medical professionals just need to listen to the parents and the siblings, because we know them better than you do. We know what they like and what they don't like, you know, and that is what I have to say about that.
Thank you, because that's a good point. That's a really good point.
When I was younger, I would go to my brother's appointments with him. And he had the same doctor from the time he was diagnosed until I think he was about maybe 15. And it was usually my mom or my dad that would take my brother, but I would go with them. And if something wasn't looking right, or if it wasn't where it should have been number-wise, the doctor wasn't always the nicest to my brother or my parents. And by the end of the appointment, my parents would just feel like they were failures. They felt like they weren't doing what they could be doing for my brother. But my brother wasn't dumb. He felt like that he was a failure as well. I felt like he wasn't doing good enough. I feel like medical professionals need to have a little bit of understanding that parents are trying their best. Especially when you have a young kid in the room. You know, my brother has always been smart and understood things from the time he was younger, and I think doctors thought, oh well, he's only 7, he doesn't understand. But he did, and he would feel bad after the end of these appointments and would feel like that he wasn't doing what he was supposed to be doing, and then that would make sometimes his blood sugars worse. And so I feel like, yeah, just with medical professionals, just trying to, again, be patient and trying to be kind. He now has a doctor that has type 1 diabetes, so the doctor understands what he's going through, and it's a lot better. But growing up, that was hard to see my parents and my brother just being so defeated after those appointments.
Thank you.
Watching my brother watching him grow up and go to some appointments, I noticed that a lot of the doctors try to like rush a lot of stuff, which would make Clay uneasy or uncomfortable, and so he would kind of just like shut down even more. So I just think patience is a really big thing. Like, just take your time and try to understand that sometimes what you're doing can make this person even more uncomfortable than they already are.
Thank you.
That's great. Thanks.
Any other questions from the group?
I would actually like to add something to Dr. Norland's question. The one thing also is talk to them. Don't talk to the parents about them. You know, actually talk to them. I love it when Adam's doctors they'll be talking to my parents, obviously, but they'll be looking at Adam and facing him and talking to him, and that makes me feel a whole lot better, because like he understands what we're saying. He probably doesn't care, but he understands, you know. That made me feel better as a sibling to know that they cared enough to actually talk to him and not over him.
Thank
Great.
you.
This is Mindy. I see a chat from, gosh, I'm so sorry. It's the Utah Valley Pediatric Cherry Tree person. Is it Evelyn? And
Yes.
she asks, is your brother the only diabetic? This is to Sydney. Is your brother the only diabetic in the family? If so, how do you deal with that when it comes to his diet, especially at family gatherings, those kinds of things?
So my brother is the only type 1 diabetic in our immediate family. So there's 3 siblings. There's my oldest brother, Charlie, and then there's me. Like I had said earlier, my mom has siblings and her parents. They all have type 1 diabetes. But with Charlie, we haven't changed a whole lot. We always tried to make sure we had food that was good for him and good for all of us. I remember growing up, we had a lot of sugar-free candy. That way it wouldn't mess with his blood sugar as much. It just was a lot of reminding him to test his blood sugar, asking him what his blood sugar was. Did you take insulin? It was a lot of that. Family gatherings weren't too crazy. We were able to do things pretty normally. It was just a lot of, he has to test his blood before he eats and make sure that his blood sugar is where it's supposed to be before he eats, or, you know, if it's a little bit higher, then he needs to, you know, take some insulin. So he doesn't have really that much of a special diet. It's just a lot of checking and regulating his blood sugars.
And if I could riff off of Evelyn's question, you know, what about when you would bring your friends home? And you know, any lessons learned, any precautions that you think that we as, you know, care providers ought to kind of make sure parents are aware of in terms of considerations for their you know, their siblings of the child with special needs?
Chuck, I'm wondering if you could just clarify a little bit. Are you asking about, you know, if there were concerns bringing friends home or problems that resulted from that?
Thanks. So I guess, you know, a lot of kids growing up in families where there is not a child with special needs aren't sure how to interact with those kids, you know, kind of aren't sure what to do or how to behave or even think about that. So I was just curious, if when you would bring your friends over to the house, would you prepare them for this? Would you just let them deal with it? How would you deal with issues that came up? And is there any way you could advise, or we could advise parents to address those issues in the home?
I guess I'll go ahead. Before bringing my friends over, I was lucky enough to have a best friend who also had a sibling with special needs. So she was really easy. She understood how Adam worked, and it was really easy to acclimate her to our house. But I always tell my friends before they come over, hey, I have a brother with special needs. He scoots on the floor, blah, 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 blah. And we do that. But he doesn't bother us. He won't be bothering us. We'll do our own thing, you know. And he doesn't really bother us, you know. And most of my friends now, they've known him for so long that they talk to him and act just like me with him. But for the parents is allow the sibling to be alone with their friends. You know, if they don't want their sibling with them and their friends and hanging out with them, allow them that time. You know, they don't want to be around their sibling right now. That's the best advice I can give to the parents anyways, but yeah.
Okay, thank you.
This is Gina, and I'll just hop in on that one. Now that my children are older, part of the what we went through and what they went through, and we didn't know it until later, was they were embarrassed to bring friends home, and we were pretty much a homebound family, and you know, part of our home environment was that having Tyson on a vent and immobile and, you know, older than the rest of them in diapers and such, really was at one point really hard for them to explain to their friends, and they refused to bring friends over. And then when I heard them later, after, you know, they had two siblings pass away, when people had asked how many siblings they had, they wouldn't mention the other two, and this was before their 20s. And it hurt as a mom, but in hindsight now, with working with them and us and some mental health counseling and such, is that what we felt to do was meet them where they were at and explain and help them kind of go through those motions, because especially I found in junior high, other kids, you know, for lack of education and understanding, because they didn't have to go through that, were kind of mean about it. And so it was easier for them to avoid the subject. But what in turn happened is they started acknowledging that they were kind of mad that they were embarrassed later about their siblings and such, and now are the most, or I guess the biggest advocates, and have all gone into helping and healthcare professions to try to help not only children with special healthcare needs, but their families. So, you know, ours was a little bit different, but it has put hindsight on, you know, really what I wished I would have known as a parent back then. And even our pediatrician for years has said as well that we really wished we would have known a little bit more on how to help the siblings cope and deal with this, because we were always in crisis mode. So we were not kind of looking at what on the other side, the mental health, and helping them build those resiliency skills and such.
And I will also say, as a parent, I think and maybe Lexi can attest to this, I was so worried about Clayton not being included because he couldn't communicate, because he was just different, that I would be like, make sure you invite your brother, make sure you include your brother. And I see that now as I needed to make sure that my kids had their separate life, personal life, their friend life. I will say that all of Lexi's friends have always been, when they come over to the house, they've always been sweet and nice and just, you know, very understanding. I mean, when you first meet Clayton, he looks neurotypical child. It's when you start to interact with him that you notice things are a little different. And her friends have always been just very, very nice. But I was that mom that was like, nope, include your brother. If you're all jumping on the trampoline, your brother's going to jump on the trampoline. So in hindsight, you know, I'm looking back going, I should have let them have their friend time and not push Clayton into the mix, you know.
Hi, this is Eric. I'm Sydney's dad and a late joiner this morning. Lost keys and lost phone, but that's irrelevant here. I just want to say that as a parent, I don't know that I consulted my two other kids about how they were feeling or dealing with their brother. I guess I just always saw really good interactions with Charlie. Sydney always ran around with Charlie's group of friends. He ran around with her group of friends. A lot of times we'd have 10 kids over at the house, you know, feeding everybody. And I guess I was just naive enough to think everything was hunky-dory. So, you know, kind of looking at some of these things retrospectively, I may have had my parental head buried in the sand. So I don't know, Sid, am I right in saying that, or did we kind of do okay?
As we got older, Charlie and I hung out all the time, but I remember one instance where a friend and I were down at our local elementary school, just kind of hanging out, playing on the playground there, and my brother showed up, and I was just kind of confused because it was just him, and I didn't really want to hang out with my brother. I think I was in the 6th grade, so he was 8th at the time. And I called my mom and I was like, can you have Charlie come back home? And she was like, well, he wants to hang out with you guys. Like, just let him hang out with you guys. And I was like, well, I don't really want to hang out with him. Can you please have him come home? And it kind of turned into this little argument between my mom, my brother, and I ended up saying kind of some rude things to my brother to get him to leave. And looking at that, I wish I wouldn't have, but I also wish that, you know, my mom would have respected my wishes and just, you know, let me and my friend play by ourselves. But, you know, it is what it is.
Well, I'm glad we can blame your mom instead of me, so thank you for the right answer.
If you don't mind me asking one more question, your kids with special needs are at higher risk for being bullied. So I wonder if any of you have had experience with that with your siblings and kind of how you address that.
So I can remember one instance in elementary school where all the kids in my grade were in the classroom and we were learning a song for a concert. And I decided I didn't want to sit next to my friends. I wanted to go sit next to my brother. And so I went and I sat next to my brother, but there was these girls behind me making fun of me, actually, because I was talking to him like a regular person, and they actually had told me, you know, he can't understand you, right? And I never turned around so fast in my life and chewed out these girls. I chewed them out. I'm like, you live with him. You don't understand him because you don't know him. I understand him. He understands me. So leave us alone. Growing up, I was a very tough kid. I was very tough, and my siblings knew that, and they knew that if they ever saw anything happen to Adam, that they would come to me right away, and I would take care of it. My friends at school, you know, they would come to me and tell me about it, and I would go and take care of it. It meant leaving my classroom and going to his classroom or going to the principal about it. I was very, like, no, I would not tolerate it at all, and people knew it, and I let them know that this was not acceptable.
With my brother, not only, you know, did he have diabetes, but he was very smart. Well, he still is very smart, and I think a lot of people tried to find just any reason to make fun of him, and a lot of times it would be his diabetes because, you know, he was different from others. So he would deal with bullying. It was more in elementary school and junior high than it was high school. You know, being 2 years younger than him, we didn't have any classes together, so I didn't really ever see any of it. But talking now, he would say, oh yeah, people were mean to me all the time. And my brother's a very non-confrontational person. He doesn't really like to get into arguments with anyone, and so it hurts me now knowing that people were rude to him and that I wasn't able to help him or do anything, because I'm a very confrontational person. Like, if you have issues with me or any of my siblings or anyone in my family for that matter, then I am going to stand up for them, or any underdog for that matter. And so I wish that I knew so that I could have helped him at that time. I wish he would have told me as his sibling that he was getting picked on, but I think it might have made matters worse that his younger sister was standing up for him.
Great. Well, thank you both, and Alexis too.
Yeah. So with my brother, a lot of kids were really cruel and mean with the way he tried. Like, when he would try to say something, it would come out not how he planned for it to come out. So sometimes there was a lot of like mix up with words, and a lot of kids made fun of him for that. And I wasn't able to go to, like, we're 2 years apart, but he got held back. So I could never go to, like, I was never in his class or like really the same school. So it was, I never saw it. If I did, because I'm really protective of my brother, so I know that if I saw it, then I think, I don't know what I'd do. I mean, it's
Don't
say
hard
throw hands, because that's the wrong answer.
Yeah, I just think he was bullied, but he handled it pretty well.
Yeah. Clayton didn't realize he was being bullied. He just thought that because he can't pick up on those social cues. And so sometimes I have to be like, that guy was mean to you. No, he wasn't mean. It's like, okay. So in a way it hasn't affected him negatively yet. But I know all of my kids are very protective of him, even my nephews and my little brother, they're in the same grade. And so Colton will tell me, my little brother will tell me, hey, this kid was being mean to Clayton today. And we call the school and we put a kibosh on it. But it's been a struggle.
Well, thank you so much, you guys. I hope you'll stay for the next couple of minutes too. I think we just have a couple more slides that Heidi's prepared, but this was really, really excellent. It was everything that we had hoped for and more.
Yes, thank you all. Very eloquent speakers. Thank you.
Thanks.
So yeah, if you want to go to the next slide, I'll just touch on some things that I've learned as a parent and talking with my doctors and things. I just like all of these siblings said, just talk openly about the situation. Let that sibling know that you hear them and that you see them, because I think even as a parent, there were times that not that I forgot about the other two, they just didn't need as much help. And so I felt they were pushed back and aside. So these kids are all very hungry for attention. And so I think as a care manager and a care coordinator, when you go in to talk to these resources for not only the special needs kids, talk to them about the special needs siblings, make sure that they are making sure that the siblings feel comfortable, because they can be overwhelmed with meltdowns and aggression. And this can also lead to other behavior issues in them, loss of sleep, embarrassment, everything that we've talked about today, and involve, just like Araya was saying, involve them in the care, because they will become probably the greatest asset you have. And then spread the support around. Have a support team available. That's a therapist. That's another family member. I wouldn't be anywhere without my mom and my dad, because that is a safe place that Clayton can go to when I need a break or when I feel like my other two girls need a break. I have set aside separate times for each child. This is hard, especially when you are trying to juggle multiple things in the air, right? Making sure that your child gets the necessary therapies he needs at school or they need at school, making sure that the doctor visits are there. I have one thing that I have done, I don't know if Lexi's noticed this, but I've involved my two girls in sports, because I think it's for friends and team and confidence and positive. And but I don't think I have missed, I think I maybe have missed 3 of Lexi's soccer games. And I've always made it a point not really to bring Clayton to those soccer games, because I want to be able to give my attention to Lexi when she's playing. And even now, my mom is like, why don't you take the kids? Why don't you take the other kids? First of all, now they don't even like going, right? Because they're not participating, so they don't like going. But it's just a little bonding. Even though she's on the field and I'm screaming at her, it's still, I feel like a very bonding. I don't know if she'll agree with me, but I've tried to be like, this is my time with Lexi, practices and games. So the other thing I found was very hard was trying to treat all of the children the same. I've noticed, because my son was nonverbal and he would grunt when he wanted something, we taught him to sign, but my youngest daughter, she would grunt as well. So instead of saying her words, because Clayton would grunt and point at things and we would give it to him, which of course was not good. But then my youngest daughter figured out, hey, and she's 2 years younger than Clayton, and she figured out he got what he want by grunting and pointing. And so she mimicked that behavior. And so then I had to start doing praise the positive, making sure she uses her words and helping Clayton make him use his words, you know. And this is a big one. I noticed in every single one of these kids is I feel like they're much older than maybe they're acting older than maybe they should be. And because they have to be that parent's helper. Lexi has helped me out tremendously with Clayton. She's the one that's telling me, Mom, you've got to be patient with him. He's trying to tell you something. And this goes into too much responsibility. I feel like maybe as a parent, I've put too much responsibility on Lexi to take care of her younger sister because I had to deal with Clayton. So, and all of these siblings, Araya, Sydney, Lexi, I can see that you guys are very mature for your age because you had to be. And then just look at the positive and be proactive. Notice difference in behaviors on all of your kids. Try to, and it's hard. And then just act accordingly, act quickly for your special needs sibling because they need help and they need attention as well. One of the things I remember from one of our UCCCN meetings, probably maybe 2 years ago, and it really has stuck with me, is that we had a financial counselor on, and his daughter had special needs, and they brought up the subject of what to do when you're no longer around. Who's going to take care of this child? And that hit me like a ton of bricks. It was very like, oh my gosh, and then it started me thinking, I can't rely on Lexi because she needs her own life. She needs to do her own dreams and her own goals. And so it's always just to be open and communicate and see if something should happen to me and there's nowhere else to go for Clayton, what is that going to look like for Clayton and for my girls? I think, and Lexi hit it right on the nail. She would probably take care of him because she's that person. I don't expect that from her, but it's heartwarming. My youngest daughter, again, she'd be like, no, I'll come visit, but I can't do that. And I have to respect that decision as well. It's not fair as a parent to put it all on your siblings. So as care managers, as care coordinators, make sure we're addressing not only the special needs child's needs, but the needs of the siblings out there as well. I think, like Araya was saying, listen to them. They know these kids better than you do. Even though you've been seeing them maybe for 10 years, 15 years, they know their little idiosyncrasies. They know when to be touched, when they like to be touched. Maybe they have a specific way they like to inject their insulin. Like, just listen to them and help them. I don't know. And then there's some resources. Of course, the medical home portal has some great things. And I've put that there at the bottom. Utah Family Voices, they have some great SIB stuff on there. And then the Utah Sibling Leadership Network, it is a Facebook page and it is run, I believe, by DSPD, if I'm not mistaken. The other thing too is that there are some camps for siblings out there. I know I have a friend whose son was badly burned, 80% of his body, and his siblings were very, they needed something. And so the burn camp had a siblings day at that camp. And so it was all about the siblings, which is nice. So, and I want to say the cardiology, Camp Hawkins, had a siblings day as well. But yeah, just know that they're there, know that they're going to have needs too, just like the special healthcare, just like the child with special healthcare needs. Any questions?
Heidi, I'll go ahead and read something in the chat from Cynthia.
Okay.
It sounds like everyone did the best they could as parents and siblings in that moment. It is evident through the discussions by the speakers today that building resilience and understanding are key aspects to buffer some of the unwanted outcomes. And then she adds the caveat that it's coming from her as a mental health professional. And I totally agree that what I heard from these three young people is that you guys have gained some incredible life skills growing up in your situations, and you have empathy and humility and patience, and boy, you're just really amazing young people, and we thank you so much. And I just want to do a shout out to your parents too. I mean, clearly this was a joint effort, so thank you again, you guys, so much for your time today.
Yes, thank you all.
Thanks a lot.
Thank you.
Yeah, thank you.
And before we're all the way done, I'll just go back to our other slides and kind of continuing the theme just a little bit. In December, we're going to have someone from the University of Utah's Resiliency Center talk with us a little bit about compassion fatigue and mindfulness and some other things. And these will be, this meeting will be intended to have you walk away with some practical skills for yourselves, and hopefully that you can pass along to the families you work with as well. So thanks again, you guys. Please have a safe and healthy Thanksgiving holiday, and the rest of the time between now and our next meeting. It's a pretty scary world we're living in out there, so do your best, and we look forward to seeing you again on December 16th. Take care, everyone.
You too.
Thank you.
Thank you so much. Bye.
Bye.
Bye-bye.